What is up, Sleep Tribe? Welcome to a brand new episode of the Healthy Sleep Revolution podcast. I am your host, Dr. Meghna Dassani. Today, our guest is, someone I've known for many, many years, someone who is like a little sister to me, honestly. And she has an interesting journey and is doing great things with her practice. And I figured it would be worth our while to have this conversation with Dr. Meenal Patel. Welcome, welcome.
Hello.
How are you?
Good. How are you? Thank you so
I
much for asking me to be on the podcast.
Oh my gosh, I was just gonna say, I have been wanting you on for so long. And then there's always something, either my kid gets sick or you go have a kid or something happens. But tell our listeners a little bit about yourself, who you are, what your practice looks like. Just fill us all in.
Yeah, sure. My name is Meenal, like you said. I went to undergrad in dental school at University of Florida and then did my residency at UNC in Chapel Hill, North Carolina. My practice, I was an associate for a corporate office for about 8 years of my career in the beginning, and then I purchased a practice in 2016, so it'll be 9 years we're celebrating in Cary, North Carolina, just outside of Raleigh and private practice. And, we're not big by any means. I do have an associate and wonderful team members. We really enjoy working in the area, very technology and wellness sort of focused practice. And it's been a wild, amazing ride. And I can't wait to see what's in store because we're always learning. And one of the core values of our practice is really teaching and training. So we love it.
That's amazing. For our listeners, my family and I recently toured UNC because my little decides she is okay going away from home. And UNC Chapel Hill, I think I've told you this, Mino, is her top choice. And I told her the only reason I might even consider letting her go is because I know you're going to be there. So we'll see. We'll see
Well,
how.
I hope she picks it because then we can hang out more.
Yeah, I know. And it's beautiful. It's beautiful. Your practice has a huge focus, even though you're a general dentist, just like I am, and you see patients for all kinds of procedures. I know your practice has a huge focus on aligner therapy, as well as sleep apnea treatments. And more importantly, and this fascinates me, is the marriage between the two. Talk to us a little bit about what that looks like in your practice, and then we'll jump into each of these treatment modalities.
Yeah, sure. I got introduced to Invisalign like very early in my career. 2007 in dental, like 2006 in dental school, there was an opportunity to get training and certified by Invisalign in dental school, and they'd only allow like 8 to 10 students in our class. I can't recall exactly like how I got chosen, but I did. And I was very fascinated by it. A lot of my research, my big research project in dental school, starting before dental school in the summer, was with ortho. And so everyone thought that I would, apply to ortho residency, and I didn't. But that was my introduction to teeth movement, right? And even in that course, yeah, they taught us how to kind of do the aligners and why that was okay to do. But as a general dentist, we had no education, right? Like they didn't really focus on allowing us to do it. But I got certified and that was great. My first job that I got was not it, nobody did aligners in our practices. We had paper charts, which I swore that I would never go to a practice that you had to write charts, but I did. I wrote charts. It was crazy for 8 years of my life. And so probably towards the end of my journey at that location, I started thinking and talking about, I was like, well, I mean, my preceptor doctor was doing aligners, but there was such a need and I kept seeing it in my patients. And I talked to them. I said, hey, I know you guys don't really have a plan for your associates. I would love to start it. I don't mind to teach and train the teams to do it in the offices. They agreed, and we were very, very, very extremely successful in offering the care. And it was amazing. Obviously, I ended my stint there, but I got to dip my feet into what it felt like to provide just the aligner treatments. And at the time, I was also doing 6 month smiles. If anybody remembers
Mm.
what that was, it was brackets and wires. And
I have dipped my toes into that as well.
yeah, right. Like it just made it seem so easy and we could
Yeah.
move teeth and it was so assistant driven. But there were some drawbacks to it. There was a lot of chair time that was taken. And oh my gosh, like God forbid somebody lost a bracket or a wire fell off or something. There was a lot of like follow-up stuff that was involved with it. So when I got my practice, I made a huge investment, right? Like we took a big loan from the bank to get the office, and then I started kind of getting away from corporate. Like that was my check system of like those doctors were my check system. I never actually made any physician or doctor friends or dentist friends outside of my little corporation practice that I was with, and so I got introduced to technology pretty early on, and I started taking some courses a little bit more with Invisalign and got introduced to the iTero. I purchased it pretty like early, but I remember it was a massive decision because that machine, I mean, you could buy a car or you could buy a machine. And I was like, well, what is this machine going to do for me? And why do I need to make this
Right.
investment? And I remember thinking, like, I had just spent a lot of money and I owed the bank a lot of money for my practice. And I was like, I don't know, is this machine going to make me money? Like, I'm doing the impressions for Invisalign and my crowns and whatever, but I made the jump. I did it, and I would never look back. Like I could never imagine practicing explaining to patients what I see on their scans. The first thing, like if I haven't met a patient and if I want to look at their records, I don't look at their x-rays first. I look at their iTero scan first. So we started doing that. My first course in sleep was actually in 2016. Like I had just bought the office. Dr. Tarun Agarwal in Raleigh, he's local and he teaches a lot of dentists. Good friend of ours. He was teaching a sleep course, and I was like, I own a practice now. I should probably go look at this. Like I don't know what it is. And I think as education started increasing, I'm a big believer, probably obsessed with clinical CE. I took a lot of COIS courses. I'm always going digital smile design with Christian Coachman. I think with all the education, I started realizing you need to connect the dots. It's not just about drilling a tooth for a cavity or doing a single tooth crown or just moving the teeth for a perfect smile. It also marries into the airway, right? When I take all these courses, I think we just started connecting all the pieces. And then how does the patient's medical history play into that? What signs and markers are there clinically in their exam in their mouth? Like, is their tongue splayed out over their teeth? What is their Mallampati score? Do they have an open airway? Do they not? What are are they on sleep medications? Do they have, multiple high blood pressure medication? Like there's just so many, you start connecting the dots. And then once you know and you've seen something in a patient, and I started off slow into sleep, right? Like really slow. Like 2016, I took the course, but listen, I had just bought my practice. I didn't know anything about like payment. You want me to send a statement? I think for a year we didn't send our patients statements. Right. So like I didn't know what was happening. Like it was a wild, when I say wild, wild ride. But now like patients are responding. Our team is responding. They talk to my patients about stuff and I'm like, oh, they wanted, okay, like yeah, let's do it. That's great. So it's been amazing to be able to kind of bring the two together. And I can't say we're not doing hundreds of sleep appliances, but the fact that we've introduced it, the concept of it, our patients are more receptive.
I mean, even one life impacted is worth it. We don't necessarily have to do hundreds of anything. I mean, if
Right.
it could be, if my father-in-law was a patient and we could have done something to impact his life and he would have been around, gosh, how grateful would our family have been? So that's all we need, like one person whose life we've impacted. So how does this play out in your practice? What does this conversation or even the exam look like? Say I'm a new patient that has no clue about airway. I do know I have a tooth that's crooked and I want it fixed. And I've heard that your office is the place to be at in North Carolina to get my teeth straightened out. What would that conversation look like? What would you be looking for in my scans, my x-rays, my clinical exam? Walk me through that.
Yeah, sure. Typically our intake, I really rely on our intake paperwork, right? Like sometimes patients are like, do they read all this stuff? Yeah, I really read it. Like I look at their patient information, where they came from, how'd you hear about us? I'm really looking for signs of, we have a pretty detailed dental history form. So I'm looking for things. What is the patient interested in? Are they talking about gum tissue? Any issues with jaw? I do have a separate medical form. So I'm looking, does the patient have diabetes, any chronic diseases that they're listing, any medications that they're on? And I have a separate sleep questionnaire, right? So we've got the sleep questions on it. If the patient answers snoring, I have history. So like if a mom or a dad or somebody in the family has it, those I realize quickly, it's really interesting. Like I can quickly understand and get some information, at least started from there. Then we get a series of x-rays. So we get a CBCT on every patient that comes in, as well as 4 bite wings and 2 PAs, or anterior PAs. And then we get a scan. Every patient in our practice is scanned. And so first the patient, I mean, if you're in there for a crooked tooth and you want to align your smile, that's the first thing we'll probably talk about, unless there's some glaring infection, right? Make sure that the foundation is stabilized, gum tissue, teeth health, make sure there's no cavities, infections, things like that. And then we'll go into, okay, let's look at the alignment of the teeth and really kind of studying and chatting with the patient you over the scan. Like I don't focus my exam too much on x-rays because patients think they look like toes, right? Like they make weird comments and they think they're x-ray,
Not
they don't
heard that,
understand
but
it,
that's a good
right?
one.
Like I don't know why they say that. Yeah, I guess they kind of look like toes, whatever. But they don't get it, right? Like we're so trained in looking at x-rays. And so it's such more a relatable thing to look at the scan with them. And so the scan you can do in full color mode. You can also turn it into the stone model, which I find really nice to be able to actually have the conversation. So we'll talk about teeth alignment. The feature on the iTero is really cool because it'll show a simulation of what the teeth would look like if they were aligned. And then, we look to see, are the posterior teeth lingually tipped? A lot of our patients that have airway issues, they're lingually tipped, or hey, maybe they have a V-shaped arch. Maybe they have a really high vaulted palate. Maybe they have a deep bite. Maybe their tongue just doesn't have enough room. There's so many different modalities, like things that we can look for and kind of put the puzzle pieces together. And I keep saying that, but it is. It's like being an investigator and putting the puzzle pieces together. And maybe, the patient probably didn't say anything about sleep to me, and I would just casually say like, "Okay, how are you sleeping?" And the patient would typically say, "Well, yeah, like I'm tired in the morning," or yeah, I don't feel like a gasp for air. They'll say something that will trigger me to ask the next question, or like, hey, does anybody ever say you're snoring? And so yeah, my girlfriend does, or my wife does, but it's not really a big deal. Like I don't really need anything. And typically if I notice something, I'll take them down the line to ask questions further to get an answer here nor there. And I'm not pressuring, right? Like sometimes these patients are like, okay, I don't really want to talk about this right now. And then I just tell them like, hey, you know what? We offer a home sleep study. I'd love for you to get, tested, and we don't have to do anything with it. But if we did, we would really help you get better airway, better sleep. And see, first, my home sleep test to take it home, pretty low fee. I keep it pretty reasonable. And so patients can take it home easily. And then I show them what's possible. Like we do treatments with laser, and then we also offer sleep appliances if the patient is interested at all, or if they think they want to do something at all. But the thing with just like aligners and aligning teeth, it's like once the patient sees something, they can't unsee it. So, like, okay, if we talked about airway today and they're like, yeah, that girl's crazy. Like, why is she even talking to me about this? And I've gone into rooms and talked to patients and they're like, yeah, I'm not interested. I'm like, all right. Because the next month, 6 months, a year, they're going to be thinking about it randomly at home in their bathroom when they're putting their face cream on or, whenever. Like, it's going to come up again. And maybe one day they ask me about it, and maybe one day they don't. But at least I've done my part to let them know what I'm seeing.
Yeah, absolutely. And I think it's important that what a lot of patients don't understand is, when we talk about snoring, yes, snoring is the annoying part of it, but it's just a symptom, right?
Yeah.
It's their body trying to tell us something. The minute, and it's, I follow the exact same protocol as you do, but like I have the conversation, I'll increase awareness, and then we let them decide, but
Yeah.
stressing the point, hey, unless we have a sleep study, we don't know if you're getting into an oxygen deficit. And if so, how much of a deficit? And then that everybody understands oxygen, right? And then
Yeah.
that's what keeps them, like you said, brings things up in their mind. So I love that you're doing that. Do you see children as well?
We do. We're not a big kids practice, although I will say, me having my 2-year-old now, I feel like as I'm getting involved, she's in preschool. She's in two different preschools. Don't ask. I don't know. They're big programs, but we're figuring it out. I think as I build the relationships with the parents, and just me being a mom, like if I see a patient and they ask if we see kids, yeah, like we're like, yeah, bring your kids. And so the previous owner to my practice didn't really see many kids, but we're starting to see more kids. And I'm actually starting to, like, I do this sleep disordered breathing questionnaire for the parents with the kids as soon as a new patient. We're looking for ties, we're looking for arch width. We do a scan and photographs for all of our new patient kids as well. And you're thinking a 3-year-old, like, how do you get a scan on them? It's super easy. And it's amazing what you can see. Like, kids are really wiggly, right? Like, it's hard to see everything that you need to see in their mouth. But when I have a scan, I can see everything. Like, it's so nice. Like, I can see the vaulting of their palate. I can see the teeth. I can see how are the teeth coming together? Is there spacing? Is there not spacing? Is there something we can do to kind of help them? And parents are interested too. They're like, they think it's the coolest thing ever that they get their kid, and it's not that we're going to do something right away, but hey, at least we have a scan and we're seeing growth and development. And at the time that it's ready to do something, we're going to have that kid used to getting this treatment done.
Absolutely. You have a laser, don't you?
I do.
Tell me about it. Tell me how you use it. Share
Yeah.
with our listeners how that procedure can potentially help with airway issues.
Absolutely. I actually started my laser journey. I bought a diode. And at the time I was like, oh my God, I have a diode. This is amazing. And in dental school, we didn't learn anything about lasers. And so when I first got it, it was really fun and I used it for years. Probably about a little over a year ago, I got my Photona laser. And it has been, I would say, life-changing to have it in the practice. There is a treatment called night lace, and specifically for sleep. And what it does is just induces collagen production on the soft palate and almost raises the uvula and the soft palate for the patient. A lot of them have a bigger tongue volume, and slouching tissue. And so to be able to offer that treatment, it's not the end all be all. And that's what I tell my patients. Listen, this is not going to be like sleep apnea is not like a magic wand and it's like gone, poof, like I wish. Our patients wish that, but it's not. And so, hey, maybe we do just that laser treatment. Maybe you are already a CPAP user and you want to do the laser treatment. Maybe that's a combination. Or hey, maybe you are doing combination mandibular advancement device and the laser. Like, you have to build a plan for this patient. But I haven't done many cases. Again, I'm new with it, but even in the cases we have done, I mean, let's be honest, it sounds a little hokey, right? Like, I
I think it's fascinating
I
because
mean, it's amazing. Like it's like I guess it's not hokey, but it's like mind-blowingly amazing that something like this could work. And it's almost too good to be true in a way. And so when I started doing it on patients, I was like, and when you first start something new in the practice, you've done all the coursework, you know it works because anecdotal, you're seeing studies and you're seeing results and you're talking to your colleagues. And of course, patients are like doctors are
it's been
showing
around for
results.
years. It's,
Yeah.
when technology is new to us, it's not
Right.
necessarily new to the world of
To the
dentistry.
world. Yeah. And that's the thing. For me, it was
Yeah.
new. And so I would go into a patient case thinking, I mean, I don't know. Like it's kind of scary. But then the patients come back and they're like, one patient in particular, she has gone through everything possible, completely refuses to use a CPAP. I even called her ENT and I said, listen, is there anything we can do to help her? And he said, no, she needs to wear CPAP. She needs to wear CPAP. And I went into her case thinking, okay, talking to her and saying, listen, I mean, let's try really she really wanted to try. We did all the sessions. She came back for a cleaning appointment, and as I was sitting her up, she said, Dr. Patel, and she paused, and I was like, oh no, he's about to tell me something. Maybe it's not going well. You have that kind of in you. And she's like, I feel amazing. And I was like, I can't thank you enough. And she wrote us the best review. And she said, I get up every morning and I'm so positive and I have so much energy. And she was very like depressed, like she lived at the beach, but she lives at the beach, but she's like depressed and she didn't feel good and she felt worn down and she felt so tired. And now this is the thing that changed it. And it's just like, you can't make the stories up when you hear your patients like say that, right? Like it's so cool.
Some days it's the reason I go to work, right?
Right? Yeah,
You see
it's
all
so
the time.
true.
Yeah, that's the good that comes out of like, oh my gosh, here we go, more CE, spending more money. But then when you impact lives, switching topics, you have some exciting big projects in the works.
Yes.
Tell our listeners a little bit about this. And, for those listening and tuned in, this is more so for the dental community. This piece of news applies mostly to doctors. Even though our podcast is aimed at parents and everyday folks, we have a ton of professionals that tune in. And I really, tell us about it. Let me
Yeah, yeah,
talk.
yeah. I've always been interested. Like I said, I've just been like a CE junkie and nerd. And so I get so many dentists and doctors, even my friends, my colleagues are like, how are you doing this in your office? Like, how do you do this? And so I am going to be launching my course. I would love to teach dentists and their teams on how to implement this work, how to make the marriage happen between an aligner and sleep practice, and how to get your team to help you get there, right? Because we do a high volume of aligners in our practice, and I can't do it myself. I really heavily rely on every piece and part of my team, my hygienists, my treatment coordinators, my dental assistants. Like, how do you get this to happen? And so finally, I decided that I would love to share what we're doing in our office.
Yeah, and what contributes to your success with aligners as well, right? Will you be teaching about how to treatment plan those cases, what
Yes,
clean check should look like, all of that fun stuff. So I
I
know
will.
for one, I'm super, super excited about it. Where can people find you?
I do have a Instagram, Preston Dental Loft. That is my practice. My website is prestondentalloft.com. And personally, I do have an Instagram, Invisalign Queen of NC, Invisalign Queen of North Carolina. And I can't wait to hear from you guys.
That is amazing. So, for those that are tuned in, we will drop all of Dr. Patel's website details, her info, contact information, Instagram handles, all of that in the show notes. So, do not be scrambling to write this down if you're driving, but we will have all of that available for you. As we wind up today's episode, Dr. Patel, what are your top 3 tips for people, parents, families that might be listening?
Number one, go to your dentist. And if you can find an aligner in Airway Dentist, that would be amazing. Don't
Mhm.
ignore the signs of sleep apnea. Really, it's there. There are solutions that are out there that don't require some of the things that are traditionally done. And stay healthy, stay happy, and drink lots of water.
Oh my gosh, that's a good one. Drink water. Well, folks, that's it for today. Thank you so much, Dr. Patel, for coming on, taking time away from your beautiful family and your practice to drop these wisdom pearls for us. If you or somebody that lives in North Carolina or know somebody that lives there, well, you now have a fabulous dentist that can help. As always, leave us a review, subscribe, and share this episode. I will see you guys next time.